My name is Vera Stavroulaki. I'm from Wings ICT Solutions, an SME based in Greece. And I'm going to talk about remote health monitoring and emergency services powered by 5G. So, first of all, just a brief overview of the different healthcare use cases that we are addressing in the 5G Tours project. We have 4 use cases here that involve monitoring and intervention enabled by 5G. So this first webinar is about the first 2 mainly, whereas the second one focuses more on the other 2. So with remote health monitoring and emergency situation notification and optimal ambulance routing, that is the main focus of this presentation. Starting from the remote health monitoring and emergency situation notification, this of course is not a new concept, let's say. However, until now, healthcare professionals were a bit reluctant to accept this. And the main concern was whether the service could be efficient enough. So this is where 5G comes in, offering high-speed, ultra-reliable, low-latency communication, which is instrumental on providing a service that can be perceived as efficient. In addition, the current coronavirus pandemic has also increased the incentives for efficient remote health monitoring. On one side, we have reduction of on-site referrals for routine care due to the fear of potentially being contaminated by a visit at a doctor's office or in a clinical setting. And on the other hand, there is also the increased need to actually continuously monitor status of non-critically ill patients, which may be quarantined at home or at dedicated venues, that could also benefit from such solutions. So we see here also, just indicatively, according to a recent McKinsey survey, that, for example, there has been a shift from an 11% use of telehealth in 2019 to now a 76% being interested in actually using telehealth, and also a much larger acceptance by healthcare providers. So what is this use case about? This use case aims to showcase how 5G can be utilized for real-time monitoring and dissemination of information relevant to a health incident that has taken place or might be forecasted. Why 5G? As I mentioned also before, in this particular use case, it's very important to have very low latency and high reliability to guarantee timely interactions and delivery of data. In case there is a health incident, or in general, just for the monitoring, it is crucial to ensure that the data will arrive at the right time, at the right place, and all the involved actors are able to instantly react. This is a view of the system architecture that we have implemented for this remote health monitoring system. So on one side, as we can see, we have a variety of wearable devices measuring parameters such as heart rate, blood pressure, oxygen saturation, and also providing electrocardiogram. And there is a part of intelligence residing in the cloud. This is used on one side for identifying any current issues, for example, if some measurements have exceeded certain predefined thresholds, but also for forecasting potential future issues. Of course, in the near future, the idea is to be proactive, to be able to potentially raise alarms before a situation becomes too problematic. And this intelligence is also responsible for notifying users, family members, or healthcare professionals. The third part, the so-called dashboard, that provides the visualization of all of the information as well as the notifications and the alerts. Here we have a view of the different devices and what they measure. So we have different vital signs or parameters being provided by the different devices. Just to mention that especially the WeThings devices are also medically certified, as well as the Boyer pulse oximeter, which also provides some heart rate information, whereas other ones are a bit, let's say, more lightweight devices, if I can put it like that. Also for testing purposes, for being able to do some measurements that are really related with how powerful 5G can be. We have also developed a proof of concept device that plays the role of an emulated blood pressure device. Moving on to the intelligence. As I was saying before, the intelligence in the remote health monitoring system enables basically healthcare experts or also family members to be informed in case, in particular, heart rate or blood pressure measurements are critical or are out of range, based on some predefined thresholds that can be configured through the platform. The other case is also if there is a trend identified towards a problematic situation that might lead to a health emergency. So this also raises an alert that can then be assessed by a healthcare professional, and this person can then decide if further action is required. In particular, for the analysis of heart rate, we use ECG signals, and we try to identify certain indications for cardiovascular diseases such as arrhythmia or so on. So basically, we have developed a method based on deep convolutional neural networks for heart rate anomaly detection. For this, because it was difficult to initially involve real users due to all the ethical implications as well, we have used an open database, as we can see here, so the MIT VIH arrhythmia database, to pre-train the model, and then applied this for a sort of forecasting of or identification of heart rate anomaly detection. Just a very brief word, this database is available at the link that we see here, and there are recordings on 47 subjects, roughly equally distributed between male and female. Similar for the blood pressure, here we do a sort of prediction or forecasting of systolic and diastolic blood pressure measurements into the future by using a specific model. Again, here we use an open database, like I said also before, to circumvent this initial let's say also ethical issues of involving actual patients in this first work on training the models. Here we have data again from an open database with about 10,000, a bit more than 10,000 ICU patients, with a variety of records and also different vital sign measurements, let's say. We mainly use the data on the non-invasive blood pressure for the systolic and diastolic prediction of the blood pressure. Okay, moving on to the dashboard. The dashboard has been designed with taking into account feedback from healthcare professionals, such as the Hospital of Rennes, which is a partner in this project. on the vital signs that are more crucial to be monitored, as well as considering for at least healthcare professionals, the ability to display the data from multiple patients on one screen at the same time. As I was mentioning before, the dashboard basically visualizes patients' real-time data, so the ones that are coming directly from the wearable devices, but also stores this data, so it is possible to eventually view historical data, different patient statistics, and be able to perform data comparisons or download data for further analysis by a healthcare professional. And this is also where there is a first view of the alerts or notifications in case of identified emergencies based, as I was saying also before, either on the real-time values or on based on the predictions made for the heart rate and the blood pressure. For purposes, in order to be able to showcase the benefits of 5G, currently, the dashboard is also being used to display some KPI recordings. A quick view of the dashboard, although this will also be presented in a video at the end of the presentation. So this is the first login screen, let's say. And this is a view of roughly what it looks like when a healthcare professional first enters the system. So it's possible to view different patients and different measurements coming from various devices. One thing to mention is that potentially not all of the patients have the same devices. This is why, for example, we can see here that for this first row of patients, there are different parameters being displayed. So this depends really on which device each patient owns or is wearing, let's say. It's possible to add a new patient. This is, of course, for the administrators of in a clinical setting, for example. So it's possible to add personal details, to add devices and configure those devices. By device configuration, the main point is really setting also the thresholds of what may be considered as a critical value, heart rate or blood pressure, for example. And this can be different and personalized per patient and per device he or she uses. Then there can also be relative details for communicating with family members of the particular patient, or details on the medical history of a specific patient. This is a view of what it looks like once a healthcare professional enters into the details of a particular patient. So we've got here, for example, heart rate, systolic blood pressure, diastolic blood pressure, the details of the patient, which can also be expanded, and graphs showcasing the latest evolution of the blood pressure measurements. The same can be done also for the heart rate or also for other parameters that are supported for the particular patient. It's also worth mentioning that if it is a patient entering the dashboard, then this would be the first screen that he or she sees. So there's also, of course, the view changes depending on the role of the user. This is just a view of how the ECG is presented as well, coming from a particular device. And now we move on to the optimal ambulance routing. The optimal ambulance routing essentially is a continuation, let's say, of the remote health monitoring case. It is triggered as a result of an identified emergency where it is necessary to pick up, let's say, the patient and transport him or her to a hospital. The main concept here is to provide real-time navigation to the ambulance, both to the site of the emergency and back to the hospital. to ensure the timely provision of medical help. The aim here is to show how 5G can facilitate the fast and reliable data acquisition on various changing factors that are taken into account for the optimal ambulance routing. These factors include, for example, traffic conditions, city events that may be affecting specific routes, and also it takes into account 5G coverage, considering that potentially it's necessary to have also high quality video call to assess the status of the patient on the way to the hospital as well. So essentially, I already mentioned some of the reasons why we need 5G here. So the potentially high throughput in case video streaming is required. It is also very important to have high location accuracy to be able to guarantee correct positioning of the ambulance and the desired destination. And again, similar to the previous case, to have low latency and high reliability to guarantee timely delivery of the data. Also related to, again, still being able to also monitor the patient from the hospital while he or she is on the ambulance. This is a view of the optimal ambulance routing system architecture. So again, here we have a dashboard that is allows for the visualization of all of the information, including in this case, of course, the constantly updated optimal ambulance routing information. And there is also the intelligence part that is responsible for monitoring and retrieving all the relevant data. What I was mentioning before, traffic conditions, potentially also speed regulations, 5G coverage, patient status, and available routes between the starting point and the destination, and then being able to select the optimal route from the ones available based on all of the retrieved information. So a view of the dashboard here, this will also be quickly shown in the video that follows the presentation. This provides a visualization of the optimal routes of the areas with and without 5G coverage, essentially. So the red polygons in this figure represent areas where there is no 5G coverage. For this, of course, currently we are using emulated data. And it's, again, for testing purposes, similarly as to the remote health monitoring dashboard, we have the visualization of some network KPIs. And finally, we also provide the possibility through this dashboard for ambulance personnel to potentially decide if they just want the fastest route or a route, or it is necessary to have a route with 5G coverage. The intelligence, initially the candidate routes are identified from the starting point to the destination. And for each of these routes, the optimality is assessed considering traffic conditions, city events, 5G coverage with configurable weighting. So this can be changed depending on what needs to be considered. Then this information is basically translated into spatial points or areas to be avoided or preferred for the different routes. And eventually the optimal route is selected. Basically, it's sort of a trade-off between the minimum time required to reach a certain destination, while also minimizing the exposure to potentially dangerous, let's say, areas if an accident has occurred somewhere, or even potentially we could consider other cases like even air quality if that plays a role, or the case of avoiding areas where 5G coverage cannot be ensured in case this is necessary to have some high quality video streaming from the ambulance to the to the hospital. This is based on a multi-criteria decision-making method. This roughly wraps up the work that has been done so far on the remote health monitoring and emergency situation notification and the optimal ambulance routing. Just a few words on the next steps before I also present the video that shows a bit more on the features of both of these cases. So we have some further enhancement of intelligence planned, which is related to additional forecasting related to vital signs such as oxygen saturation for the remote health monitoring case, and also the inclusion of additional functionality such as fall detection or locating an individual outside a predefined area. So this is the so-called geofencing. This can be useful for individuals that suffer from dementia, for example. Again, this is for the case of the remote health monitoring. Whereas for the optimal ambulance routing, we are still considering adding some input to the selection process for the optimal route. And of course, an important part for where we are also in the 5G Tours project is to intensify on the testing, to be able to really showcase through the measurement of KPIs how 5G can empower such use cases. So now I'm going to present the video.
Remote health monitoring and emergency situation notification focuses on a tourist with chronic health issues that needs to be monitored by a remote medical team. Here we can see the overall system architecture. The key components of the Wings Starlit Cloud platform include wearable and other user devices used for monitoring various health parameters, cloud analytics comprising data ingestion, management, and intelligence for the identification of current health issues, forecasting of future issues and health emergencies, and corresponding notifications. A dashboard designed for providing visualization of health monitoring data, notifications, and alerts to doctors and healthcare professionals. The notifications are raised in case one or more monitored parameters are critical or out of range, and recorded values show a trend towards a potential problematic situation leading to health emergencies. The Withings ECG Move Watch is a clinically validated device which provides measurements for heart rate, cardiac rhythm, altitude, and acceleration. The Withings BPM Core device is used for heart rate, ECG, and blood pressure monitoring. Fitbit Ionic is used for heart rate monitoring, GPS, and 3D acceleration. Boiler PO60 pulse oximeter is used for oxygen saturation monitoring, while Whatten Global A20 Watch collects information for heart rate, blood pressure, and location. Samia Sensories is used to monitor environmental parameters such as temperature, humidity, air quality, atmospheric pressure, noise, light, and movement. The Wings Proof of Concept device exploits 5G capabilities for the transmission of blood pressure measurements. This is the remote health monitoring dashboard. The cards of the subscribed to the service patients are displayed in the patient's overview table. A user can subscribe a new patient by pressing the plus button. By clicking on a specific patient tab, the latest values of patients' vital signs are displayed for the monitored measurements. The user can see the measurements of its vital signs at various time intervals. For demo and testing purposes, key performance indicators such as device latency and latency for getting all patients' measurements are also depicted in the dashboard. The user is also able to see the predicted values for the monitored parameters. A patient is wearing the BPM core device and the systolic and diastolic blood pressure, heart rate and ECG are recorded. An alarm is raised after identifying high blood pressure, while cardiac rhythm rate are deemed normal. In the scenario presented here, this triggers the dispatching of an ambulance in use case 9. Use case 9, optimal ambulance routing, addresses real-time navigation of the ambulance, both to the site of the emergency and back to the hospital, to ensure the timely provision of medical help and patient immediate transfer. The ambulance dashboard visualizes optimal ambulance routes that are continuously updated to different hospitals, thus enabling the ambulance staff to make the best decision based also on the patient's condition. In this case, the ambulance staff can select a route in which there is sufficient 5G coverage. The relevant intelligence identifies the optimal route in terms of the minimum time required to reach a destination, while also minimizing the exposure to potentially hazardous situations and taking into account the user's health condition and the need for high-quality video streaming throughout the route.
Okay. This was it. So thank you for your attention, and I'm open to answer any questions if there are any.